The first describes what's going on globally with health. Globally, and certainly in countries of middle and high level of economic development, such as Trinidad and Tobago, non-communicable diseases predominate. In low-income countries, NCD, non-communicable disease, and communicable disease are approximately equal, but in a country like Trinidad and Tobago, non-communicable diseases are now in the majority. Secondly, globally, as right here, the world is aging. And that presents challenges, but also opportunities. And third, in the views of many, the number one problem facing us in the world is inequality. Inequality between countries and inequality within countries. I live and work in London, in the London Borough of Westminster, which is where the Houses of Parliament are located. When I was still cycling, before I had an accident, could get on my bicycle and cycle from the Houses of Parliament around the borough, and I would, in about 35 minutes, have covered a life expectancy gap for men of 18 years. 18 years. That would be like getting on a plane and flying to Ethiopia to see an 18-year gap in life expectancy. And I don't need to catch a plane to do that. I can get on my bicycle and cycle around one part of London. What's the life expectancy gap for different socioeconomic groups in Trinidad and Tobago? I don't know, because we don't have the data. Where we do have the data, what we know in country after country after country, there are huge socioeconomic inequalities in health. And in fact, health follows a social gradient. The more years of education, the higher the income, the more affluent the area in which people live, the longer they live, and the better their health. So this trilogy applies very much to Trinidad and Tobago, but we do need better information to get a handle on the magnitude of the health inequalities. Then I have a second trilogy when it comes to the question of, okay, how are we going to address these problems? Commonly, people say, we'll do it with disease control. We'll get better treatment. Or in the case of non-communicable disease, we'll get everyone to behave better. Get them running around the park in the morning or giving up smoking. Well, that's one approach. Experience from around the world suggests limited progress when you pursue such an approach. The second is health systems. The World Health Organization, the World Bank, are very much putting priority on universal health coverage. Much to be applauded. It's very good if everyone can get access to health care when they need it. But I can tell you that that will not solve the problem of improving health and reducing health inequalities by itself. People need health care when they get sick. It's not lack of health care that causes the onset of illness in the first place. And that leads to the third part of this second trilogy, which is the first being disease control, the second being access to health care. And the third approach means addressing the social determinants of health. And by social determinants of health, I mean the conditions in which people are born, grow, live, work, and age, and inequities in power, money, and resources that give rise to those conditions of daily life. And I was invited here to Trinidad and Tobago and very pleased to come by the Trinidad and Tobago Medical Association, by the Commonwealth Medical Association, by the University of West Indies, by the Ministry of Health and others, because there's a real desire, I think, in Trinidad and Tobago to get serious about action on the social determinants of health, to improve the conditions in which people are born, grow, live, work, and age, thereby creating a healthier population with narrower inequalities in health. The prospects are very good. The prize is very great. And to achieve it, it will take concerted effort from the whole of government, not just the Ministry of Health, but right across government, civil society, and the population at large. But as I say, the prize is very great. It means greater health and well-being for everyone in Trinidad and Tobago, regardless of the circumstances of their birth. Thank you.